Did you know 178 million Americans are missing at least one tooth? Dental implants is a perfect solution for those that are missing 2 to 3 teeth. If you are one of these Americans, there are 5 key questions that you're going to want to ask your dental provider before committing to dental implant surgery. Hi, my name is Dr. Sharel of Park Smiles Family and Cosmetic Dentistry, and in today's video, we're going to tackle 5 questions that you need to ask your dentist before committing to dental implant surgery. This will help you to determine the best doctor for your implant. Question number 1, will the dental implant and crown be placed at the same office? All right, the reason why you should ask your doctor if the crown and the implant can be placed in the same office is, 1, it's convenient to have all the work done in the same office. No one wants to go to separate offices to get treatment done. It's time consuming. It takes, scheduling is an issue. So it's always important that you ask this question because, 1, to have it all done in the same office will save you time and energy and frustration at the end of the day. Another benefit of having the crown and the implant done at the same office is that you don't have to worry about it being different type of systems. If a surgeon places one type of implant and you have to come back to my office, I have to figure out what system that surgeon uses. If I don't have any familiarity with his system, then it can be a challenge. And so if the implant and the crown is done in the same office, you know for a fact that it will not be an issue with matching parts because there are tons of systems. You want to make sure that everything matches. How will the doctor take into consideration your medical conditions and needs? When considering implants, it is important that we know a full medical history breakdown. For those patients that are smokers or if you have diabetes, these are things that will delay the healing process or it can cause your implant to actually fail. So these are questions that we're going to screen you for in your initial consultation. And so it's important that you're very upfront and thorough when it comes to providing information to your dentist. Next question, what is the provider's formal training in implantology? So I've had extensive training when it comes to implantology. I've taken several fellowships and it has extended over a period of months. And so for me, I gained quite a bit of knowledge when it comes to training with implantology. Next question, how accessible will the surgeon be following the surgery? Following your surgery, you may have some questions or there may be some complications. Just know that as a provider, I will make myself available to answer any questions and ease any issues, fears, concerns that you may have. This is normal. It's a part of any surgical procedure that there's complications that can arise or some type of discomfort. And if you need to reach out to me, I will definitely make myself available and schedule an appointment is not a problem. Next question, what will the full implant journey look like? All right, let's walk you through the dental process from A to Z. At your first appointment, you will meet my staff, you kind of get a tour of the office, and then we're gonna do a CT scan, which is a 3D imaging of your tooth. It gives me an idea as to how thick the bone is. It tells me what size implant would need to go in that space. It lets me know where the adjacent teeth are, lets me know where the vital organs are, like your nerves, so I can avoid that and minimize the risk or any complications that you may have following the procedure. Once I've done all these things, it's up to you to decide the next step, which is to get started. So once we get started, you come in for the appointment and the implant is placed. Obviously, we're gonna make you as comfortable as possible. You will not feel it. Everyone asks that question, will it hurt? It will not hurt. You will be anesthetized and so you will not feel a thing. So we place the implant that day and you will come back in about 4 weeks where we do the post-op appointment. We assess everything to see how you're healing and answer any additional questions that may have arisen over those 4 weeks. Depending on how fast you heal, if you have any type of medical conditions that will delay the healing, but on average it's about 4 to 6 months before you come back in. So say you're one of those that heal fast, whatever, you'll be in 4 months, and what we will do is scan your tooth so that, 1, we can send it off to the lab and get you your permanent crown. It's going to take another 2 to 3 weeks, and once that happens, you come in and you leave that day with your new tooth in place. So there you have it. These are the 5 questions that you should ask your provider before committing to dental implant surgery. I hope you found this to be valuable and you feel more confident about going forward with your decision. If you're looking for dental implants, we actually have a new patient special. Right now, you get $500 off your treatment. All you have to do is click this link around this video, fill in your information, and my staff will reach out to you to book your consultation as soon as possible so you can get all the information that you need from me. Again, my name is Dr. Sharel of Park Smiles Family and Cosmetic Dentistry. I hope that you've enjoyed watching this video and I hope to meet you soon.